Hi, I'm Dr. Kristina Tansavatdi, and I'm a double board certified facial plastic surgeon. I specialize in rhinoplasty surgery. In this video, I'm going to answer the question, do I have a deviated septum? How do you know you have a deviated septum? And what is a deviated septum? I'll go over those answers to those questions. A deviated septum is basically there is something that separates the two sides of our nose, and that is called the septum. In some cases, people are born with this being crooked, so the one side is more collapsed, or in some other cases, it might be due to trauma or some other causes that causes that septum to deviate. It's like two sides of a room, and the wall between the two rooms has gone crooked. And if it's deviated, you're going to have one side of the nostril that's really plugged. So how do you determine if you have a deviated septum? One good way to test is to plug one side of the nose. I'm not going to do it myself, but literally what you're going to be doing is closing that side and then breathing from the other side. And you test each side individually. Now you have to do this multiple times, several times a day in one day, and then multiple days in a row to make sure that you're actually getting not what we call a normal nasal cycle. What does that mean? That means that inside your nose you could have what we call these turbinates, that there's spongy tissue that goes up and down as we breathe. And on some times of the day, one side's more full. On other times of the day, the other side's more full. So it could be falsely telling you that you're congested on one side, one part of the day, and then another part of the day, you're congested on another side. So that would be that it's not a deviated septum. So it has to be consistently one side of the nose that is blocked. And if that's the case, that may mean, now I said may mean, it doesn't necessarily mean it is convincingly a deviated septum. Now what do you do if you have a deviated septum? If you are concerned and you're like, okay, one side's more blocked than the other and it's consistently being so, then you could have surgery, or it could be a simple solve as you go to your doctor and there are some sprays that you need to try first, or there could be what we call breathe right strips that you put on the top of your nose to open up the valves so you can breathe better. It does not necessarily mean you need to have surgery. If you feel that it's constricting your breathing consecutively when you're asleep at night, so you're either snoring or there might be some other issues where when you're trying to work out, you're struggling to breathe, that might be some indications that the deviated septum is affecting your overall breathing and affecting your function. And that might be one of the reasons why you should have a rhinoplasty surgery or septoplasty surgery to fix that. So there you have it. I hope I've answered your questions for you thoroughly. That's how you know you have a deviated septum. Thank you for tuning in.